Hi, I am Dr. Sid, and I am the clinic director at ScoliSmart NYC. If you or your child has scoliosis, chances are you've been told one of three things: watch it, brace it, or prepare for surgery. But what most families are never told is that there's a much more important question that should come first. How flexible is the curve? Because curve flexibility often determines whether treatment can actually help or whether you're just buying time. This is for parents of children who've just been diagnosed. It's for teenagers being told they may need a brace or surgery. And it's for adults who've lived with scoliosis for years and are now dealing with pain, postural collapse, or progression they were told would never happen. If you're looking for clarity instead of fear-based decision-making, this is for you. One of the strongest predictors of scoliosis outcomes, whether with exercise, bracing, or surgery, is curve flexibility. Flexibility tells us how much correction is even possible, whether a brace is likely to help or fail, and whether surgery, if needed, can achieve meaningful correction. That's why two kids with the same curve can have completely different outcomes. Take Allison, for example. She was diagnosed at age 7 with a 21-degree curve. Active, athletic, and terrified of being braced. Using our early-stage neurospine care approach, we assessed her curve flexibility, neuromuscular control, and growth risk. Instead of waiting and hoping, we intervened strategically. 7 years later, Allison never needed a brace, and her curve actually improved while she stayed active in sports. Then there's Jessica, a competitive gymnast with a 46-degree curve. She was told surgery was inevitable. But when we evaluated her, we found something important. Her curve still had meaningful flexibility. Through our intensive scoliosis bootcamp model focused on neuromuscular control, targeted loading, and postural retraining, she stabilized her curve and avoided surgery. She's still competing today. Then there's Tanya, an adult who wore a brace as a child and was told she was done. Years later, she was in daily pain, losing height, and watching her posture collapse. Her issue wasn't just the curve, it was loss of adaptability in her spine and nervous system. Through our adult scoliosis program, she reduced pain, improved alignment, and now has a long-term plan to stay strong as she ages. The difference is that we don't treat scoliosis as just a crooked spine. At ScoliSmart, we use our neurospine care model, which looks at curve flexibility, neuromuscular control, hormonal, and growth influences, genetic risk factors. Because the curve itself is only the symptom, not the cause. This approach isn't for everyone. If you're looking for a quick fix or unwilling to participate in the process, this isn't the right fit. But if you want clarity, strategy, and a real plan, even if that plan includes surgery, then this approach can be life-changing. If you want to understand what's really possible for you or your child, the next step is a conversation. Visit scolismart.com to schedule a consultation. We'll review your case, your imaging, and your goals, and give you honest guidance about what makes sense and what doesn't. No pressure, no guessing, just clarity. I'm Dr. Sid, and if you're ready to stop reacting to scoliosis and start taking control of it, we're here to help.